about, okay? So I want to start with our wellness and health education classes because that's how the booklet starts. Next one, please. Okay, so with TakeCare, we have, we are really big on preventive care, wellness, health education. And we have all these classes. These are health education classes that are manned by certified trainers. They've all gone through the class to be able to educate our members. Go ahead. And so you'll find that we have diabetes management, a lot of cardiac risk management, nutrition counseling. Next slide. We also target a lot of the children's program, Children's Health Improvement Program. We feel it's really important for kids to start young, right, in terms of nutrition and also fitness. So we have a Children's Health Improvement Program. What it is they come to a class. It's a 4 weeks, every Saturday type of program. They get nutrition counseling, and they also have fitness workouts throughout those four Saturdays in the month. Next. Now, this is our wellness program satisfaction ratings. So we measure a lot. So out of all the participants that have attended all of our classes, our overall participation satisfaction in the classes is about running at 96%. So you'll see for our diabetes management, cardiac risk is right at 95. And then our stop smoking classes are really successful, 100% satisfaction there. Wellness workshops and worksite wellness again. So a lot of ratings as per participants and how they feel the classes have affected them. Next slide. We also measure the success of these classes. So for instance, those who have attended the diabetes management classes, we push a lot on sustaining a very healthy level or having a 10% improvement. So for those that have attended the diabetes management program, we have about a 63% positive outcome who have improved on their HbA1c level, being at 77% or less. Those attending the cardiac risk management classes, if they're monitoring their cholesterol, good or bad cholesterol, those who've had improvements for cholesterol have really had 100% improvement on cholesterol. And also high blood pressure reading, we have about 67% satisfaction. Okay, so again, the point is that we monitor how we're doing as trainers and interacting with our members to get you to a healthy level. Next, please. This is our group fitness schedule. We also offer free fitness classes. So Monday through Sunday, 7 days a week, we have yoga, hot hula, Zumba, water aerobics, and that's held at the Hilton Pool and TRX. So you can find this in your packet, and that you can see whatever classes may interest you. Okay? The next slide, please. All right, so we also partner with the community. We have Zumba classes at the Go Play, and those young parents who have young children, you can put your children in the kids zone and while you're working out. Okay. We also have recently partnered with the University of Guam, and so we have a program called Walk a Mile and Earn a Fitness Stamp. So what this is just again interacting with our wellness team and just walking 1 mile a day and getting a stamp for doing that. If you feel like your knees can't handle Zumba or, hot hula, then you could definitely join this Walk a Mile program that we have. Next, please. Okay, so as of 2017, we were able to also count the number of participants. We have about 11,500 of our members who have accessed the different programs that we have, the different classes that we have. So you can see that the Zumba classes are very popular. But again, just knowing that what we've done is to our membership have highlighted the importance of being active, having a healthy lifestyle. Okay, so again, a lot of activity on health and wellness, our physical activity with TakeCare members. Go ahead, please. Next slide. Okay, and I want to go now into the wellness and fitness incentives, and you'll find this on page 6 of our booklet. Next slide. And what you're seeing here is our our wellness incentive for preventive care. We really push on preventive care. A lot of people say, well, I don't need to go to the doctor. I'm very healthy. I don't go to the doctor. But for us, I respond by saying, well, you should at least have your annual physical, have your annual mammogram, your pap smear. So again, we really feel that's the importance of that is essential. And we, in fact, incentivize people to have that done because some people just won't do it. But so we give you, if you have it done at FHP Clinic, it's $50 for your annual physical. If you have a cancer or colonoscopy, it'll be $25. If you have your physical outside of FHP and you're at your own clinic of choice, we still pay you certain amounts to have your preventive care done. Let's go to the next slide. Next slide, please. We also follow, I didn't mention vision and dental. That too is essential in having that done annually, so we also pay you for that. But this part here really talks to adherence to medication for insulin or asthma, and we incentivize you to stick to that adherence, and we also pay you for doing so. Next slide, please. Now, outcome-based bonus, this I really like. And this is for people who have chronic illness, okay? So, and the chronic illness consists of like high blood pressure, high cholesterol, or high blood sugar levels. So if you fall into this category, we really stress the importance of maintaining or sustaining a normal level or having a 10% improvement. In that. And we will, what it is we will incentivize you to improve through the quarter, and you can earn $50 per quarter. Now, if you have high blood pressure or high cholesterol, we capture this through the claims. Number one, we can identify you, or you can call our wellness team. You will have to attend our class, and we work with your doctor, your primary doctor, to ensure that you're following all the procedures, the medication, to get you to that healthy level where you need to be. And again, it's $50 per quarter for your improvement throughout the year. Okay? The next slide. This fitness incentive program is targeting body mass index. Again, BMI is very important. Having a very healthy BMI also contributes to good cardiovascular health. So if you work out, if you take advantage of the gym membership and you work out and you try to get your body mass index at a healthy level or have a 10% improvement through the quarters, you can earn $50 per quarter. And how this works is that you work with your gym. All our gyms, we have 19 gyms, by the way, they all have a gym portal. So let's say you want to go to the Hilton or you go to Paradise Gym, for instance. They will punch in the gym portal with TakeCare and punch in your biometrics. And then we'll see that, and then they'll help you improve on your BMI through the year. And again, that's $50 per quarter. If you complete 10 visits to the gym, if you visit the gym and do 10 workouts in the month, we will pay you $10 per month for doing that. We used to pay a little bit more, but we put more of the incentive toward chronic illness and BMI and more results outcomes. Okay, the next slide, please. These are our fitness partners. Those of you who are with NetCare, I know Hilton was a big partner for them, so we've been able to continue having them on board for TakeCare. And so International Sports Center, and all these, please review this on page 9. You'll find this on your booklet. PFC is Paradise Fitness Center, so we do contract with them, and that's for Dedido and Agano. And that's 100% covered. We also have children. If you have young ones that are 5 and 6 years old, they can do skip. They can do the taekwondo, self-defense kind of things. And you can also change up your gym. If your husband wants to go to Paradise and you want to go to the Hilton because it has a sauna, you can certainly do that. If your son wants to do some Muay Thai or your daughter wants to be a skip dancer, then you can mix it all up. Okay? So that's a good thing with us. Next slide, please. Okay, this is our gym enrollment form. You'll find this in your packet. We will ask, if you have it TakeCare and you're just rolling over, we do ask you to complete the form and turn it into us. You must submit a form to have gym, to have access to the gym for this 2018 to 2019. Okay, next slide, please. Again, we can capture your visit to the gym through an electronic. This is through the TakeCare app, or we can do it. You can capture it or keep track of it through the paper stamp card. Next slide. And this is what you'll find in our TakeCare app. You'll see as you get into the app, you'll have a virtual member card, so you can keep that with you. If you have your grandchildren or little kids enrolled under TakeCare, you as well can keep their virtual card in there. And then you'll see this 10 different stamps. So my HRA, that's where the gym partners will punch in their code. And once you're done with 10 visits, it'll send a message to us, and we will monitor that for 3 months that you complete 10 visits, you'll earn $30. And you don't need to do anything. We'll just send you that check. Okay? Your biometrics, that's where you can follow your BMI. Next slide, please. This is our, what is it? It's a TakeCare member portal. And this you can follow your claims and do your health risk assessment. The next slide, please. Provider network. Let's go into our provider network, and one includes, of course, those of you who are not familiar with us. We own and operate our TakeCare FHP clinic, which is a one-stop facility. The next slide. At the FHP clinic, it's a premier clinic, okay? It's very inclusive of medical care. So you've got adult medicine. We have a woman's OBGYN clinic. We have, you'll find lab there, a pediatrics, radiology, urgent care. We also run a FHP dental clinic, home health. We have nurses that go to the home to take care of you if you're not doing well. A pharmacy. We have an oncology, hematology clinic, and a vision center. The next slide, please. This is our urgent care clinic. This is what makes us different as a health plan, is you have access to a walk-in clinic should your doctor not be available. And so FHP's urgent care clinic is open 7 days a week from 7 a.m. to 11 p.m., 363 days a year. We only close 2 days out of the year. And on our plans, the FHP has made an initiative to waive the deductible on both plans, including the 2000 plan. So if you're on the 2000 plan and you feel like you need to go to the doctor, you don't have to meet your deductible. You just go and pay a $20 copay for urgent care access. Okay? Okay, the next one, please. Okay, this is our diagnostic imaging center. I like to talk about this. I'm really proud about the fact that it's state-of-the-art, high technology. All our equipment is brand new. It is accredited. They are all accredited by the American College of Radiology. And our MRI machine is top of the line, the best of the best. You can't get any better on island except Naval Hospital. A 3.0 Tesla. It gives you double the resonance. It gives you direct diagnosis right there on that first try. CT scan is available. We're going to be doing an upgrade there. Digital mammogram, ladies, is really, it's a lot lesser screening, quicker testing. The ultrasound's available, digital ultrasound, digital x-ray. We also do interventional exams. We do steroid injections. Echocardiogram is available. Our bone density for osteoporosis. DEXA scan is also available at FHP. Next slide, please. Our CT scan, again, we have a plan to upgrade, so we're excited to have that come along the way, looking for 3D colonography. So in the future, you may not have to do that manual colonoscopy. It may be able, through the future, doing all digitalized. So I'm looking forward to that one. Okay, next please. Next slide. We have a staff oncologist, Dr. Umbrali. He's an oncologist, hematologist. So for any blood issues, again, board certified. He's also an adjunct professor at UOG. So he kind of works with the community to do some clinical studies in our community regarding cancer hematology. The next slide, please. This is just a snapshot of some of the doctors. We have a lot of local doctors on island. A lot of them have been with us. Our pediatricians have been with us for 30-some years. Many of your children and grandchildren have probably grown up with Dr. Bob or Dr. Stadler, but we also have many other physicians, internists, family practitioners that are with TakeCare, FHP. The next slide, please. One Stop, this is our on-island provider network. We do have specialists. This is on page 20. Please review that page. The next slide. In the U.S. and Asia, I'm sorry, I need to go back. I'm sorry. On the Guam network, yes, thank you. The only thing I'll have to say is that we are not contracted at this time with GRMC and SDA. Okay, so not to say that the door is closed, but at this time we are not contracted, so just FYI there, all right? Okay, next slide, please. Okay, U.S. and Asia, so in the continental U.S., we have a large network there. We also have another rented network there, multi-plan, etc. Hawaii, Straub, Kapiolani, and then in Asia, a huge network in Asia as well. Next slide. In the Philippines, we have the St. Luke's Medical Center, both at the Quezon City and Global City. Everybody loves the St. Luke's, right? That's number 20 in the world, actually. And we have the Medical City, Makati Med, and then we have some clinics also in Iloilo, etc. The next slide. Travel allowance. What this is, the travel allowance is a reimbursement of your airfare and your lodging should you seek specialty consultation or procedures in the Philippines. And so what this is you will need to meet the deductible on both plans to avail of this. You'll need, so for instance, if you have a dermatology issue or you need to see a cardiologist or so, you'll need a referral from your primary doctor. It must be prior authorized by TakeCare's medical management. And then, once that's done, as you move forward, when you come back, you can submit your ticket and your hotel expense. We'll pay that up to $500 per patient. It's not limited to once per year as that's medically necessary. If a child needs to seek care off island, we will also, the child is eligible for the travel reimbursement and one accompanying parent or legal guardian. And we will just pay the airfare of that parent or legal guardian up to $500. Okay, the next slide. In the Philippines, we have a PI formulary listing. So we have a drug listing, and if you are prescribed a particular medication in the Philippines, you can avail of Access Mercury Drugs or MedExpress. And these are only specific locations, but we will let you know what those locations are when you get your packet, okay? We also have dental in the Philippines. If you wish to have your dental work there, we have Affinity Dental. They have about 5 or 6 different locations, and your dental is covered at 100% in the Philippines. The next slide. The summary benefits. Let's go into the summary benefits. Next slide. Okay, and so as you see here, the 1,500, our benefits, our rates have not changed. They have remained the same as last year. We're just rolling over. So as you know, the 1,500 is basically a combination of co-pays and the deductible, right? So you've got the first portion is your primary care, your specialist care, your urgent care, those preventive care, those services are not subject to the deductible. Now, if you need to see a primary doctor and you choose to go to FHP, you will just pay $5. If you go to a preferred provider, which to us it's American Medical Clinic, that would be a $10 copay. And if you go to other clinics outside of American Medical and FHP, primary care is $20. You don't need to meet the deductible. Specialist care is $40. And then your labs with TakeCare is 100% covered for routine labs. You don't pay any copay for routine labs. Specialty labs are for labs that cost $200 or more. Okay? Outpatient radiology x-rays are just $10 at FHP. And we do cover, and then the rest of the benefits are basically the same, but for generic formulary, it's $10 at FHP. Next slide, please. Okay, here's a 2,000. As you know, the 2,000 is all deductible except for preventive care, right? So preventive care is, again, your annual physical, your mammogram, your pap smear, and that is those are not subject to the deductible. The only thing that is subject, everything else is subject to the deductible. Okay, on the 2000. Let me know if you have any questions. Go ahead to the next, click. The other benefits that you'll find under TakeCare is a PI, the executive checkup. For the executive checkup on both plans, the 2000 and the 1500, it is not subject to the deductible, even on the 2000. That's one of the benefits that's different with us, is you do not have to meet the deductible if you want to go for an executive checkup. Now, once you meet your deductible, your benefits, it will be 100% covered in the Philippines. So let's say you broke your leg and you know, you need to have surgery, orthopedic surgery, but you have never gone to the doctor, but you're on the $1,500 plan. All you need to worry about is meeting your deductible, first of all, which is a $1,500. And if your surgery for orthopedic care is $50,000, that'll all be covered at 100%. You don't pay anything out of your pocket, except for things like blankets or whatever else they charge you, okay? And then we have, of course, the 150 optical benefit. If on the PPO 1500, your annual eye exam is covered at 100%, but you get a $150 optical benefit for glasses or contact lenses. And then you do get a travel allowance. That's also different with TakeCare. Yes, next slide, please. Okay, and then your dental is the same. Dental hasn't changed. It's 100% covered for diagnostic and preventive care. You get $1,000 of benefit per member per year. Your oral surgery, periodontics, endodontics, those are your root canals. Your root canals, it stops there. It's 80% covered. And then root canals is at 50%. Prosthetics. I'm sorry, no, let me take that back. Prosthetics are your crowns and bridges. And that is at 50%. Okay? $1,000 per member per year. Next slide, please. And this is our TakeCare mobile app. What this is we have an app that you can just download on your smartphone. And again, you can have a virtual ID card with you. And you can access our affinity partners. Yeah, all the gym and fitness, you can find it all on it's a very interactive app. I'm sure you'll find that very helpful and useful. The next slide. And then it's continuing on the app. We're very big on social media. Please follow us, like us on Facebook and Instagram. We try to post daily. Next slide. And then we have a 24-hour customer service line. Again, I think that's what's different with TakeCare, again, is accessibility. If you have any questions or you're encountering an issue or a problem, you can reach us 24 hours a day. If you're off island in the mainland and you have an emergency arise, you can call us toll-free, 1-877, etc. And a local number is also available 24 hours a day. And the next slide, please. Our affinity partners, again, you'll find this in the booklet, page 16. And these are just different partners that you can go to. These are many of our groups, and they have special discounts. If you go to Outback, you can have a special appetizer. You can go take the kids to an ice cream shop, and there's a lot of discounts there. Please see this on page 16. On the next slide. And so the TakeCare Advantage, trying to wrap this all up before we get to the rates. $5 copay at FHP for primary care, and also for your annual eye exam, $5 on the HSA 2000 plan. For primary providers, or preferred providers such as American Medical, you only pay $10. 100% coverage for a routine and preventive lab. We don't pay anything for labs. Gym membership, we pay 100%. We've got 19 fitness partners. We offer you free disease management and wellness programs, free fitness classes 7 days a week. You can earn up to $700 per individual or $1,400 per family just taking full advantage of our wellness and fitness incentives. You have exclusive access to the FHP Health Center, exclusive access to the FHP UrgentCare 7 days a week, 7 a.m. to 11 p.m., 363 days a year. The next slide. You get 100% coverage in the Philippines for inpatient and outpatient care services after you meet the deductible. We also have a Philippine network for prescription drugs and approved medications. We give you a $500 travel allowance. We have a 24/7 dedicated customer service line, a TakeCare member portal, and we give you our TakeCare mobile app. And the next slide. And so these are our rates. As you know or may know, our rates remain the same for this year. So for HSA 2000, employee only is $194, employee and spouse $26.63, employee and children $22.63, family is $36.76. That's husband, spouse, and children. PPO $1,500, $23.78 for single, $73.98 couple, employee and children $62.19, and family $102.76. And then, of course, a dental, you've got there class 1, 2, 3, and 4. Okay, and I'm just about done. So we've wrapped this up. I think this is this is the last slide. Let's go to the next slide. And we want to thank you. We want to thank you so much for your time. And I think I'm right within the time limit, right? Okay. Any questions? Yeah. Well, I'm just about done. We have 5 minutes if you'd like to ask any questions. Yes.
Does TakeCare have anything to do with trying to recruit a doctor for dermatology, like a dermatologist?
Yeah. Great question. The question is, are we trying to recruit any dermatologists? Well, the good news is we have introduced telemedicine at FHP. And telemedicine targets 4 different specialties, and that's rheumatology, dermatology, neurology, and cardiology. And we partner with Good Samaritan in LA, and it's just like having a doctor here. So, I mean, it's on the, telephonic, basically. But we make the appointment for you. You sit in the doctor has all your medical records, and as if he's here. Now the doctors will rotate and come out every quarter to see the patients. But that's a great question, and so we are trying to address the specialty void or necessity on island. Thank you for that. Did you have a question there, ma'am? You're good? Yes? Yes. Why do they send you off island? If the question is, we have cardiology at FHP, why do we send you to GMH? Our cardiologist is Dr. Kim, and as I said, Dr. Quiros is a cardiologist from Good Samaritan, but he'll do telemedicine. So what you do is you work with your primary doctor and get a referral. You can send it to you can bring it to FHP or send it to our medical management. Basically, you don't need to be prior authorized to see a specialist, but if you want to be set up for telemedicine with a cardiologist, with Dr. Quiros, who has an excellent reputation and comes to Guam frequently, you can see him. Now, depending on what your condition is, if you need an angiogram or you need something more specific at GMH, but we can talk about that later on your specific case of why you need to be sent to GMH. A stress test, yes, that's because it's done there. They probably have the machine at no, we don't have the stress tests at FHP. Yeah. Yes.
Are you still working on some kind of contract with the new hospital and SBA, or you're not going to have any relationship?
Well, yes. At this time, currently, we have to answer that question is we do not have a contract at this time. I want to say the door is not closed. Okay, we have lots of members in, and so I mean, I like to say it's never say never, right? So the door is not closed. We at some point, hopefully, we'll get to that point. But like with GRMC, again, it's about the rates. If the rates are so high, your premiums are going to go up. Everything affects everything, pretty much. So at this time, we are not contracted. So if that's important to you, you'll have to make those tough decisions. Correct. SCA is not contracted at this time with us. Yes. Thank you. Okay, I think I pretty much have wrapped this up. I want to give our friends at SelectCare their time. I want to thank you so much as well for your time. We'll be right outside if you have any questions. again. All right, God bless and have a good rest of the day. Thank you.
I think so. I have to stand up and be proper. I was actually going to be very informal, sit on the table and talk with you guys, but we are on TV. So, good afternoon. My name is Herman Atta. I'm going to step a little bit back because I feel like I'm right in your face. My name is Herman Atta. I'm with Calvo SelectCare. I'm working with Marilu Dimalanta, and we have two other colleagues out right outside the door, Valerie and Jay, who can answer your questions after the presentation if needed. We can also accept your enrollments or any of your transactions as well this afternoon. If you guys can throw up this PowerPoint slide for me. This year, if you sat in my presentation last year, we did the same exact presentation at the other legislative building. It's the same presentation. The contract has been extended. We're just calling it a rollover year. A lot of things have changed over the last year. Like now we're in this really nice legislative hall versus where we were last year. So a lot of things have changed, but nothing has changed with your insurance benefits. It has rolled over this year, and everything is functioning just as it did in the previous year. If we can do the next slide. If you're not familiar with Calvo SelectCare, we've been working with the government of Guam, insuring the government of Guam continuously since 2001. Our company right now, Calvo SelectCare, is the largest health insurance carrier in Guam and Micronesia with over 45,000 members. We have offices here in Guam, in Saipan, in Palau, and 3 offices in the Philippines to assist you if you're receiving care out there. For those of you that have received services out there, you know it's a very large office of quite a few staff members to assist you with anything you need to do out there. We work with Tokyo Marine Pacific Insurance, TMPI. They are the underwriters for the Calvo SelectCare plan. In insurance talk, they're the company that pays for the claims. So when you go to the doctors or when you go get prescription medication, Tokyo Marine Pacific Insurance, it's their money that pays down those claims for us. They are a very large insurance company with a global presence. They are working in over 37 countries throughout the world. Big pockets. They have an AM Best, A+ financial rating. So they're very financially secure with very large financial resources. And that has helped Calvo SelectCare participate in the Government of Guam Health Insurance Plan, has kept things stable for us, and has allowed us to work with you folks since 2001. In addition to the AM Best rating, we are also have an accreditation rating with AAAHC. So we had an off-island company come in, accredit our plan, go through our services, our procedures, how we do pre-certifications, referrals, how we pay our doctors, and we were granted accreditation by this team, and it's part of our requirements to work with the federal government. Next slide. By virtue of being the largest health insurance on Guam, we insure quite a few companies throughout the island. The PowerPoint slide gives you a logo representation of some of the larger companies we work with and some of the small companies. But I'd like to bring your attention to the right side of the screen, that box of medical provider logos. Calvo's Insurance and Calvo SelectCare insures more than 90% of the medical community. So the same doctors, hospitals, clinics that provide health care to you folks, they turn around and use the Calvo SelectCare insurance product to insure their own families and their own employees. So I think it's a good testament to the product that we offer, that these doctors use our insurance plan as well. So it might be something to think about when you're also selecting a health insurance for you and your family. Next slide. Some of the plan highlights, like in previous years, the plan is functioning the same way as it has. All the benefits that you've come to be familiar with and have enjoyed with the SelectCare plan continues. We do have access to the new hospital. We do have access to the SDA clinic. GRC is Guam Radiology Consultants, where you can get some of the more complicated or some of the big diagnostic testing like MRI, CT scans, digital mammography. Pacific Cardiology Consultants. I heard someone talking about a cardiologist. They are one of the few cardiologists available here on Guam. 100% coverage for your annual physicals in the Philippines. That's become a very popular benefit that was introduced by Calvo SelectCare to the government of Guam, and it's been very, very popular. So you can get an annual physical in the Philippines once per year, and it's based on the United States Preventive Services Task Force listings, and it's based on your age and your gender. Basically the same annual physical you can get here on Guam. We've negotiated a package in the Philippines and added a couple extra goodies, and you can take advantage of that. Free gym access, that's been the big question every year. Do I still have my gym? Can I keep my membership? Your gym memberships with our gym partners, Paradise Fitness Senator, I guess because I'm in the legislative hall. Paradise Fitness Center, Synergy Studios, Custom Fitness, and Unified. Free membership for you and your dependents that are enrolled in the plan. I'll give you some more details on that in a bit. Incentive rewards for working out in the gym and for doing some stuff in your annual physical and taking health assessments are available. And our lifestyle club continues. We do have a new mobile application that you can use to access that benefit, and I'll show you a slide on that in a little bit. And we've worked, as we have in previous years, to keep our rates as affordable as possible for you. Next slide. Two plans, like in previous years. The HSA 2000 and the SC 1500. Two identical benefit plans. The only thing different is how the deductible works and how much your deductible is for both plans. I'll go over briefly, not all the benefits, but some of the more commonly used benefits. On the HSA 2000, it's a $2,000 deductible plan, so an individual needs to pay up to $2,000 of their own medical expenses before the plan benefit kicks in, with the exception of your preventive care. And preventive care would be your annual physicals, immunizations and vaccinations for the kids, well women care items, and prenatal care. All those items are offered free, 100% covered, and the deductible doesn't apply to it. For the rest of the plan, for anything else, $2,000 individual deductible applies. You pay that down, then you can take advantage of the rest of your benefits. Next slide. Some of the benefits you have available to you. Diagnostic testing is what we call 80-20. We pay 80%, you pay 20% after you've met the deductible on this plan. Durable medical equipment with pre-certification. You can get crutches, wheelchairs, stretchers. 80-20, we pay 80%, you pay 20% after your deductible. Next slide. Next slide, sorry. Hospitalization, if you need to be admitted into the hospital, it's 80-20 as well. You pay 20% after you've paid your deductible. Co-pays on this plan are for your outpatient physician care and services. These are your doctor's visits, specialist visits. A doctor's visit would be $20. A specialist visit would be $40. If you need to get an x-ray or labs done, that would be a $20 copay after you've paid your deductible on this plan. Next slide. Prescription drugs, it's $15 copayment for generic drugs. $30 copayment for brand name drugs. If you got a specialty drug you need to get, that's a $100 copay. Again, after deductible. Next slide. The 1500 plan, the blue colored schedule of benefit there, you need to pay a $1,500 individual deductible to access your benefits. All your preventive care items, just like the 2000 plan, is free of charge. That's your second box there. Annual physicals, immunizations and vaccinations, women care, no deductible, free of charge. The difference between this plan and the 2000 plan is the next slide. Are your doctor's visits, your prescription drugs, your vision care benefit, and annual eye exam. You don't need to pay a deductible to access that benefit. So on day one of the plan, on October 1st or October 2nd, you just make your co-payments for those benefits. So if I come down with the flu on Monday, the 1st, I think that's the 1st, I go to the clinic, I visit with the doctor, I've got the flu, I would make a $20 co-payment for that. He gives me a prescription drug to go get some antibiotics. I go to the pharmacy, they charge me $15 for that medication, and then I go home. If I was on the 2000 plan, I would pay the full price for that doctor's visit, which can be anywhere from $150 to $200 here on Guam. And then I go to get my prescription, I would pay anywhere from maybe $50, $60 for the prescription drugs. I pay the full price on the 2000, unless I've met my $2,000 deductible, and then I pay the smaller co-payments. Okay? That's the difference between the two plans. The 2000, since you're paying all the deductible first, is much less expensive than the 1500 plan. Any questions on the two plans? Okay, you can skip the next 3 slides. They're identical to the brown. Your dental plan right here. Go ahead, you can. Oh, I can talk about the HSA. The 2000 plan, before I jump into the dental benefits, the 2000 plan, we do call it a HSA 2000 plan, Health Savings Account plan. Because of the way the deductible works, the federal government allows you to open up a health savings account. And you can do this with a separate vendor. ASC administers the health savings accounts. You would open up this health savings account. You would let them know how much to deduct from your check. They drop it into your savings account, tax-free. So it's all done pre-tax. So you can get a little bit of tax savings by dropping money into there. Then you can use the money in that account. They issue you a debit card. You can run your debit card and use that for medical-related expenses throughout the year. Once you open up this health savings account, it's your account. The only stipulation on that account is that you have to be on a health savings account qualified plan to deposit money tax-free into it. Okay? Even if you leave the 2000 plan and go to the 1500 next year, that savings account is still yours and you can use it for whatever you like, medical-related. If you use it for something other than a medical-related expense, then you need to pay tax on it. Okay? Even if you leave the government of Guam, start working somewhere else, or even move to the States, that health savings account is still yours. It belongs to you. Yeah? Correct. Even if you're not in an HSA plan, the account is still yours. You just can't contribute tax-free money into it. Okay? Yes. I can talk about the RSP just real briefly on the retirement supplement plan. It's a third option that's available to retirees. You need to have Medicare A and Medicare B as your primary insurance. So you need to be a retiree. Then you can sign up for that plan. And it is being offered by the government of Guam free of charge to the retiree. The rest of the details we can go over in the back. It can get pretty complicated with the way coordination and benefits work with that. But we can help you in the back on that. So that's a third option for retirees. Okay, back to the dental slide. Like in previous years, it's a dental 1000 plan. You get $1,000 worth of dental benefits for the year. Depending on the service you receive, it's a different type of co-insurance. So the basic stuff like your diagnostic and preventive care, teeth cleaning, x-rays, it's 100% covered, up to $1,000. Basic and restorative care are things like your simple and complicated extractions, 80-20. We pay 80%, you pay 20%. Next slide. Major and replacement care, that's the more larger, bigger ticket items. Crowns, bridges, 50-50. We pay 50%, you pay 50%. Again, the plan limit is at $1,000. There is no deductible for the dental plan. Okay, next slide. Okay, your provider network. Where can you access and use your benefits at? Next slide. Very easily, your local provider options. Who you can see on Guam? Everybody. We've got just about everybody on our local provider network with the exception of one clinic, and that would be the FHP clinic. Other than that, you have access to just about everything. In fact, you would gain more than you would lose with Calvo SelectCare. Like I said earlier, you have access to the new hospital, Guam Regional Medical City, Guam Radiology Consultants, Pacific Cardiology, the SDA Clinic, Express Care at the Micronesia Mall and Agana Shopping Center, also on our network, as well as just about every dentist here on island. So it keeps it very easy for you if you need access care here on Guam. On the next slide, urgent care and emergency services. You can visit the emergency room at the Guam Memorial Hospital and at the new hospital, GRMC. Urgent care is available at IHP. That's the clinic in Dedido by Costules. They have urgent care hours available between or up to 9 p.m. Monday through Friday. American Medical Center at their Upper Tumon location is available up until 9 p.m. Monday through Friday. And very shortly, we are finishing up our agreement with the new hospital for their urgent care services, which will be offered 7 days a week. So new access that will be available to you very shortly for urgent care at the new hospital. Also, someone had asked about access to the new hospital, and it was brought up, yeah, it's expensive, it costs a lot of money, but we put this up on a map with the island of Guam. A huge chunk of our population lives in the central and northern parts of the island. The closest hospital to them would be the new hospital, GRMC. So very early on, we kind of determined that we need to get into agreement with them, because one way or another, whether it be for an emergency or a scheduled visit, our members are probably going to need to access that hospital. Also, it's no secret on Guam, medical care, it can be difficult to find doctors. We don't have a lot of doctors on Guam, or it has been noted that we don't have or limited amounts of doctors available to us. The new hospital offers upwards of 100 doctors, almost 20-25% of the available medical providers here on island. So that is available to Calvo SelectCare members. Next slide. Off island, I always tease during my presentations, the font gets smaller and smaller every year. We'll have to find a new way to start presenting this to you as we continue to add providers for our members to access. Out in California, names you're familiar with, the Doctors Medical Center in Modesto, Good Sam, Cedars-Sinai is on our network. Last year, we added the USC hospitals in California, West Coast, Anaheim, LA area. And we also added the Sharp hospitals in San Diego. So a lot of us have family out in San Diego, and that's a new option for us. Offerings in Taiwan, Hong Kong, Korea, Japan. The Philippines still remains one of the more popular options for our members. More than half of our members choose to go to the Philippines for their off-island care. Familiar names like the Medical City, St. Luke's Global City, St. Luke's in Quezon City. This year we've added Makati Medical Center, so it's an additional option for our members right in the middle of Makati. Offices for our members. We have an office in both of St. Luke's locations, an office in the Medical City. We're the only local health insurance with an office in the Medical City. And that Makati Medical Center, we have an office about a block from there. For anyone that's accessed care in the Philippines with us and has visited our offices, we have quite a bit of staff out there to help you. We have a utilization team to handle your pre-certs and referrals, a customer service team to handle appointments and scheduling for you while you're out there. We can work with you on your billing and issuing those letters of authorization to handle services. So it's very efficient and quite quick for our members trying to access care out there. Next slide. A couple life-saving benefits or travel benefits that we have available to our members. An air ambulance service. Hopefully, it's one of those things you don't need to use, never need to access, and hopefully don't know anyone that needs to use it. Because when we do pull the air ambulance in for service, it's usually a life or death type situation. But it's a good benefit to have in your back pocket, and we're the only health insurance to offer that. So we can get you as much as 50% off of those services. Generally, most people use that to get to the Philippines. It's the closest place to handle their emergency. In addition to that, we have an airfare benefit for certain qualifying conditions: open heart surgery, neurosurgery, gamma knife surgery. For those individuals that qualify, it's a round-trip ticket for the individual, a round-trip ticket for a family member or escort to assist them, and a round-trip ticket for a medical escort if necessary. Next slide. Health and wellness initiatives. This is probably the fun part, or where people can get some money back and get some of the cool benefits that are associated with the health plan. The next slide. We start out with our health risk assessments. We have this as an online tool. So you can go onto our website, www.calvos.net. On the wellness section of our website is a step-by-step instruction on how to log on and access that health risk assessment. Take the assessment. It only takes about 10 minutes, 15 minutes at the most. You can even access it with your iPhones or Android phones. Finish it in 10 to 15 minutes. You get an excellent report back on what your health risks are. Are you at risk for diabetes? Are you at risk for heart disease? Do you need more fitness activities? So you get a good report back on where you're at health-wise. And Calvo SelectCare will also return back to you a $25 incentive. So we're asking you to take that, try to incentivize you, and give you $25 back to do that. You don't need to fill out any documentation. Once you take it, we have it logged in, and we can cut that check and send that out to you. Next slide. Gym memberships with our 4 fitness partners, 100% covered, free to you, and all the dependents covered under your plan. Paradise Fitness Center in Agana and in Dededo. Unified is in Tumuning behind the ITC building. Custom Fitness is here in Anigua behind the 76 gas station, the old Ambrose, if you're familiar with that. And Synergy Studios is just around the corner here. They moved from Mighty to Agana to a new location. So you can access that as well. The way the Calvo SelectCare gym memberships work, there is no deadline to sign up. So you can do that today. You can do that next week. You can do that next month. A lot of us wait to January to sign up for the new gym, and we've got our new health resolutions for the new year. But when you're ready for your gym benefit will be there and ready for you. Okay, next slide. In addition to the gym memberships, we have a free weekday workout program. These are free classes offered by our gym partners. Still offer some classes, Synergy Studios, Custom Fitness, Unified. Some classes are in the morning, some are after work, but on the weekdays, Monday through Friday. And we have a couple aqua fitness classes that we have on Saturdays as well. The schedule can change from month to month. We can email the schedule out to you. If you'd like that, give me your email address. We can send that to you. You can register that at the office. We also have it with those of you that are active employees with your health coaches. Can provide this schedule to you. And we have it posted up on our website, calvos.net. The schedule can change from month to month depending on the popularity of the class. Next slide. On-site wellness activities. Calvo SelectCare works very extensively with the agencies. There are assigned health coaches per agency that work with us on this. So if you're interested in partaking in any classes at your job site or fitness activities or classes, coordinate that with your health coach, and we can get that set up for you. This is just a slide on some of the courses that we had over the past year. Next slide. All this information with wellness is posted up in our GovGuam Health and Wellness schedule. Again, your health coaches have access to this schedule, and we also email it out to you. On your enrollment applications, there's a slot for your email address. If you put your email in there, we'll add you to the database and get these schedules out to you. Next slide. We also have additional wellness programs. We work with the SDA Wellness Clinic and Dr. Horinucci's Wellness Clinic to offer additional wellness classes to you. Diabetes management classes, wellness consultations, childbirthing classes. Most of these items are offered free of charge. Other items like the 7-day detox are offered at big discount. That is offered at 50% to the Calvo SelectCare members, and it's been one of the more popular courses that we have available. Next slide. Health and wellness rewards, you can get up to $200 for doing most of the items within your annual physical. So take advantage of that. The annual physical is free as part of your health insurance benefit, and you can get some money back for doing some of the things in that. Your health risk assessment is also included here. The way this works is you just take your annual physical throughout the year, get some of these things done, take your HRA. In December, we'll start tabulating all of that, and then get the checks cut in the first quarter of next year. The gym fitness reward program, you can get up to $300 back for the year. The Calvo SelectCare benefit works per quarter. So this upcoming quarter, October, November, and December, you need to work out 10 days, for 3 consecutive months in the quarter. So 10 days in October, 10 days in November, 10 days in December. If you don't get 10 days in November, the quarter's done. We'll have to try and get that done on the second quarter of the year. Okay? It's kind of easy to get, but it's not too easy to get. If it was too easy, then we'd all do it, right? So let's get healthy and try to access some of these benefits. Next slide. A couple additional value-added benefits. On the next slide, we've got our Calvo SelectCare website, calvos.net. All this information that we went over is on the website. In addition to that, you can access your member handbooks. Also, there's a member section that works quite well where you can log on, set up your logon and password, and you can start tracking your claims. So especially on these plans with the deductible information, you can actually start seeing and tabulating and seeing where you're at with your deductible. How far are you from reaching the $2,000 or the $1,500 deductible? In addition to the website, we've launched our mobile applications. For those of you with smartphones, iPhones, Androids, go to the store where you can download your apps. Search the Calvo SelectCare application, download it, and the same things you do on the website, you can do on the mobile application. So you can check that at the doctor while you're there. It also has a section with your member card information. So that's also handy. A lot of us don't carry the health insurance card with us, but you can get it on your phone now. Next slide. We have another mobile application that you can download. This is provided by OptumRx, which is our pharmacy benefits manager. This app is extremely useful for those individuals that take advantage of our maintenance mail order prescription drug program. With our prescription drug program or mail order program, you can get your maintenance medication through the mail. Generally, you can get a 90-day supply, and that's offered free of charge, no copay. On the 1500 plan, there's no deductible on that. So you can definitely save some money with your prescription medication. A lot of people may be a little leery about signing up because they don't want to get their prescription drugs in the mail, worried about the mail system or it coming in late. The application can help you track where it's in the mail system. If it looks like it's coming in late, you can check us out of the office and we can assist you through that process. Next slide. The Calvo's Lifestyle Club has been very, very popular with our members. So much so we've got quite a few vendors. These logos are just a sample size of the discount companies that we work with, vendors that we work with. So we had to transfer it to this mobile application so you can actually log on and see where all the discounts are and what the discounts are for you. I get in the habit when I go to a restaurant just to pull it up and see what I could possibly get at that restaurant. In addition to that, your card, your lifestyle card, you can pull that up on the application as well. So you can keep everything all in one place. Next slide. You go and skip this slide. Who's responsible for who can sign up for the plan? GovGuam employees, retirees, survivors of retirees. Your legal spouse can be enrolled onto the plan. If you're not legally married, but you have a domestic partner, or what we used to call common law spouse, you can put them on the plan during this open enrollment period. Outside of OE, if you miss this window, you have to wait to next year, open enrollment, to add domestic partners. You can also put your children onto the plan, and up to the age of 26. These children would be natural-born children, legally adopted children, or children you've been granted legal guardianship of, or stepchildren. And we can cover them up to age 26. Next slide is the deductible reimbursement claim form. We've been working with the government of Guam for a long time with these deductibles. We've been able to work with our providers and get them to start submitting their claims to us electronically. So most of our members don't need to fill out this form to get your claims or your deductible information registered with us. We get that information automatically with the doctors and the hospitals. But some instances when you may want to use this form, let's say you ended up at the hospital this weekend, you can get a big bill really quick and meet your deductible in one visit. If you want to get that registered quickly, you gather up all the required paperwork, and on the form, that small print in the middle is a full listing of the items that we need. Submit that with this form to the office, and then we can register it into your deductible a little bit quicker than waiting for the hospital to send it to us. Next slide. Important information. Basically, if you are already signed up with Calvo SelectCare and don't need to make any changes, we don't need any forms. It'll roll over automatically on October 1st and renew with us. If you want to sign up with us, if you need to change between the 1,500 and the 2,000 plan, maybe add or drop dental, or add or drop a dependent onto your plan, then we need applications from you. We have some forms out in the back here, and you can fill that out with us. You can visit our office. We're open to 5 p.m. up until Friday. The deadline to turn this in is on Friday. We're also at the Micronesia Mall from 10:30 to 6:30 today through Friday. Okay, so if you need any assistance with that, come visit us, and we'll be happy to help you. And my last slide is a thank you. Thank you very much for working with Calvo SelectCare and staying with Calvo SelectCare. Questions? They're correct. There are certain drugs. There are certain drugs just by virtue where we live here on Guam. The regular mail order or regular mail system, we will not be able to accommodate perishable items. They were doing it at one point, but the success rate of getting it here was not so great, and it poses too much risk to our members. If your medication is coming in, you're relying on it being good and ready for you, and it's not when it comes in. So some medication, they have recently pulled it off of the list as mail order, just because you're much better served picking it up here and making sure it's good, it stays good. Yeah. Yes. Sure. Yeah, understand. Mm-hmm. Yeah. Mm-hmm. Mm-hmm. Absolutely. Absolutely. First question was, can you help get a dermatologist on island? Personally, I have a child that needs dermatologist services as well. That's a common problem on the island, getting specialists in here. It is difficult, and when we do get specialists, sometimes they don't stay too long and they leave. We do try our best to interest people in coming. What we do, though, is, and Calvo does this, and it's part of our policy, is as soon as specialists and doctors become available on island, We work very hard and very quickly to get them onto the provider network and get them available to our community. An example is GRMC. SDA Clinic, we work very hard to have a good relationship with them. They bring in a visiting dermatologist quite frequently, at least once, sometimes twice a year. They have someone coming through. So the best we can do right now is making sure that when somebody gets here, we work as quickly as possible to accredit them, vet them, and then get them onto the provider network and available to our members. The second question was the ambulance benefit. There is an emergency transport ambulance benefit on both plans. However, that benefit is accessed after you've met your deductible on both plans. Okay? You okay? Mm-hmm. Yes. Yes. Mm-hmm. Uh-huh. Yes. Paradise Tumon, we don't, the premium gym they call it, Paradise Premium, is not part of the free gym access. However, Paradise does offer preferred rates for Calvo SelectCare members, and they can give you that when you go there. It's not part of the free package right now. The 4 partners that we worked with, we developed relationships and have contracts with them. They're the 4 partners that can offer you this benefit any given time, at any point during the year, without any caps. Some of the other locations, a little bit smaller, and maybe not willing to take on 1,000 new government of Guam employees or large-scale membership. So that can be an impediment to us. So right now, these are the 4 gyms that can accommodate that for us. Yeah. Okay. Yeah. Yeah. Yes.
To have something like that down in Agate?
Fitness center?
Yeah.
We don't open the fitness centers. We work with the guys that are professionals at that. So maybe they have something in the plans, but it's not something that Calvo SelectCare does. Yeah. Okay. You can run to the gym in Aganya and then work out there. Okay. All right. Thank you, everybody. And we're out in the back for more questions.